Okay, we're back from the break, and I understand that Miss Rogers is still on the phone. Are you there, Miss Rogers?
Yes, I am.
Okay.
Sorry to take up so much of your time. I wanted to ask you really quickly. I'm sure you have specialists working with you. Do you have an endocrinologist who would be of the basically same frame of mind as you are when it comes to natural or integrative medical therapies?
I don't have an endocrinologist that works with me in the office. They're an interesting specialty. I have difficulty getting patients into endocrinology a lot of times. They seem to be a specialist in need. So with that being said, and I don't know that there is even one that may come here. I think Healthcare Partners may have one that might circulate through the community at some point, but other than that, most of the time I'm sending patients to Las Vegas for that. Are you still there?
Yeah.
Okay.
Okay. That's all.
And then to find a specialist within endocrinology that believes in alternative medicine, it's going to take a lot of questions on your part, and it may basically take you researching or basically calling that office. You may get that information, you may not. And it may be one of those things where you may have to do a trial and error thing. You may have to go see them and see what their belief system is, and don't be afraid to ask if they believe in alternative medicine or they believe in other things. But as you get into higher level of specialty, there tend to be more evidence-based medicine than not. I think when you get into family practice and maybe even doctors of osteopath, DOs, you'll probably get more alternative medicine in that group than you will in allopathic or MD medicine, just because of it's just kind of a fraternity more or less, and that's just, they do it the way that they were taught, and those people were taught that way, and those people were taught that way, and it keeps being taught down the line from there. So I hope that answered your question.
Well, it kind of does. I need a primary care physician, and but I need one that has some connections to an endocrinologist, or at least works with one and knows one. So I don't know. Right now I'm just winging it, and I guess I'll keep on doing that for a minute, but maybe one of these days I'll be able to have a consultation with you and see what we can work out.
Oh no, and I think that's fine. And one of the things that is a detriment to this particular area is that we don't really have a connection with a lot of the specialists unless they come up here and practice in your office. And that being said, most of them are so busy down in Las Vegas that they have no reason to come to Pahrump. And that's been a problem that's existed for a long, long period of time. I've often laughed about it when I first came here. It's very beautiful here, the mountains, the clean air. It's relatively cheap to live here. It's just when you get sick, you realize what a difficult area this can be if you're ill. And if you don't drive, and as you get older and the roads get a little bit more difficult, you kind of trapped into this area. So that is a problem, and they don't put that in the brochure when you move to Pahrump. So anyway, well, I thank you, Ms. Rogers, for calling and asking those questions. And again, for a viewer audience, if there's anything that I may be able to help you with, then certainly please call in and we can try and discuss that. Getting back to, I believe, what I was talking about before we were dealing with Ms. Rogers' issues was the longer days, and as the days become longer, we see more grass, we see more flowers, we see more allergies, and this is a time when you'll start seeing a lot of springtime allergies, and people will start to having their sneezing and their runny nose. So it's kind of like you get out of the cold and flu season and you start running into the allergy season. And as you know, a lot of people suffer from allergies, so they go and they get their products like Benadryl or antihistamines like Allegra or Zyrtec and all those over the counter. And they're very, very useful initially in fighting the allergic reaction, which, as to try and put it in terms of what happens in that the pollen or the dust or whatever it is that you are allergic to is our particulate matter, which attaches and has it attaches to a specific cell in our body called the mast cell, M-A-S-T, and histamine is released. And histamine is a very important product in our system, and histamine in the brain can do some things, but outside of the brain, it basically can dilate blood vessels. And if you do what's called a wheel and flare reaction, you can see the effects of histamine. If you just take your arm and scrape it and put that, you will eventually see that it will turn red and kind of pinkish, and then it will maybe even have a little bit of swelling, and that's called the wheel and flare reaction. And histamine, because you have disturbed your tissues, will be released into the surrounding tissues, and you'll get vasodilatation, which means the arteries will open up, and fluid or hyperemic, meaning it becomes red, will start to evolve, and slowly but surely that will eventually resolve if you don't take off your skin in the meantime. But that basically is the allergic reaction in a nutshell. But unfortunately, in our mucous membranes, it causes a rhinorrhea, which is basically an itching and maybe a runny nose. And then we get sneezing, and it starts to sneeze and sneeze and sneeze, and so you can't get over it, so you take an antihistamine. And what does the antihistamine do? Well, it blocks the histamine. So you have this tug of war between the histamine receptor and this antihistamine, which prevents this histamine from coming in. And when the battle is all over, hopefully you've gotten out of the grass or gotten out of the mulberry bushes or those particular things that have caused you to sneeze, and the reaction goes away. But there is more. There is a late phase of every allergic reaction, which is mediated by a different set of chemical mediators called leukotrienes. And this is what they call the late phase, or the 8-hour post-allergic response. So if you're continuously being exposed to, let's suppose, pollen or dust in the air, and you're continuously wheezing, then what ends up happening in that case is the antihistamines just cease to work. And with that being said, now you're looking at doing another antihistamine, or you think you might have a sinus infection, you're going to go to the doctor, and I'm going to want antibiotics. But really, you need to be prescribed other medication, which are leukotriene inhibitors, and the two that have been on the market for a while are Singular or Alkalate. And these particular products are obtained by prescriptions, but can be very effective in helping you fight the late phase of the allergic reaction and actually returning your nose to a balance to where you can actually breathe effectively. So that being said, if you get the antihistamine Zyrtec or one of those over the counter, and they're all probably as good as one or the other, I think if I'm an asthmatic and a COPD patient, I would stay away from Benadryl, and I might tend to lean towards Allegra. It's less anticholinergic, but if you're an asthmatic, I would definitely stay away from Benadryl. It just seems to have some problems. And if you're an older male and you're taking Benadryl and some of those central acting anticholinergic antihistamines, you may have difficulty urinating. So it does contract the bladder. And so with that being said, we're coming up to that particular time of the year. So if you have prostate difficulty, the over-the-counter antihistamines may cause you significant difficulty in urinating. So be aware of that. So I like Allegra. It's probably the best. You can get 60 milligrams. And you can take up to 3 of those a day, or 180 milligrams would be your maximal dose. And if your symptoms are going away, then great. But if you're one of these chronic allergy sufferers, then I would tend to be a little leery of just using those and keeping those other products on the market. Now, one of the things patients like to do, the other thing is if your symptoms are purely nasal, nasal inhaled corticosteroids can be relatively effective in controlling your nasal symptoms. But the side effect of that is they're very drying to the nasal membrane, and one of the side effects is mucosal bleeding. They are not like the other products, which are the Afrins and the four-way nasal sprays of the world. Those are very drying, and those cause a medical condition called rhinitis medicamentosa. And what that means is when you use an Afrin or a spray like that, it will work for 12 hours the first time you use it, and then it's going to work for 10, and then it's going to work for 8, and then it's going to work for 6, and then it's going to work for 5, 4, 3, 2, and then you're done. At that point, you can't get any relief because your nose is going through a rebound, and it's basically rebounding from this stimulant product you're putting in your nose. So I caution those people that use Dristan or Afrin or four-way nasal spray. Now, there is a way to use it, but you have to be very scientific about it. And what I tell people to do is to use it in one nostril, and I also get saline, like nasal saline, and I dilute it each time I open the cap, and I kind of, dilute it with a squirt of saline or two before I use it, and I clear it out, so I'm getting the diluted solution, and I only use it in one nostril, and I use it in the nostril on the side that I sleep on, because blood tends to pool. If you're a side sleeper, blood is going to pool towards the side you're sleeping on, and in doing that, you're going to want to open that side up while gravity tends to pull that away. So we're going to go to break, and then we're going to talk a little bit about cortisone and then possibly a little bit about hypertension. And thank you again for tuning in tonight. Hi, I'm Dr. Michael Reiner, your host of the Independent Doctors of Pahrump, a TV show that airs Monday night on Channel 46. I want to remind you that I am a practicing physician in Pahrump, and I'm an independent practitioner, which means I am not bought by any insurance company or corporate medicine. We provide the highest level of care. We have nurse practitioners. We have other physicians, specialists who come to our office. Please come visit me. I'm at 1316 East Calvada here in the heart of Pahrump. Thank you.